This is the hospital that is supported by Friends of Nyakibale. I worked here from 1990 to 95. In 2005 I returned, and now again in November 2008 I'm back. Again we are surrounded by my friends. Now we're going to look after some projects that are completed by the hospital.
Welkom.
As soon as Dr. Rob enters the premises of the hospital, it shows that his friends of former days haven't forgotten him. Then it's time for work. With Jeff Cacciola, the American hospital administrator, Dr. Rob checks the books.
Here's the receipt to show proof of payment.
Together with Claudia Turriamariba, the human resource manager of the hospital, Dr. Rob points out a route along the most important projects. This autoclave, a machine with which you can sterilize instruments, was donated by the Friends of Nyakibale. This is the incinerator, financed by Friends of Nyakibale. It's an important building. Here all the disposal of medical treatment are burned. On several spots on the hospital grounds there are placed latrines. Friends of Nyakibale Hospital have also made a contribution to this hotel canteen where the workers of the hospital can eat and relax. Friends of Nyakibale Hospital are very proud of having achieved this brand new doctor's home. You may ask yourself, what's the importance of this home? In order to keep the doctors at the hospital, we cannot pay sky-high salaries, but we can make their stay more comfortable, and that helps. These are buildings where the staff of the hospital stay. Daniel is one of the two workers who could finish his education as a nurse with the help of Friends of Nyakibale. In line with her task of outreaching regional healthcare, the hospital provides medical care 2 times a week in a place in the region that's not easy accessible. This time, the community-based healthcare team brings a visit to Bimirongo Bugangari. Today's program is the education and vaccination session for young mothers and their babies. About 30 women are being educated in a professional way. They learn how to deal with their pregnancy and their newborns. Medicine is being distributed to prevent malaria, worms and anemia. And the little ones are given their vaccination. And the usual pregnancy checkups are being performed. When the job is done, everybody can go home. Rotary Berkel has committed itself to a contribution to renovate the baby nursery facility.
Baby nursery, dat staat voor de afdeling voor pasgeborenen. En kom zo even naar binnen.
Let me show you the work that has to be done.
Zoals je ziet is het een wat klein kamertje waar
It's a very small room with 3 newborn boxes. The room shall be made bigger and a water tap is being introduced. It's going to be a very good project.
De muren en er komt ook een betere drinkwatervoorziening. Echt een goed project. Een nieuw project.
A new project is the improvement of the sewerage of the hospital. Up to now, every building has its own outlet system which gets overflown and that you can smell. And now the hospital has the plan to make a new sewer system with big lagoons in these grounds outside the hospital. A necessary but very expensive project we want to support. This is one of the 3 10,000-liter water containers that are donated by friends of Nyakibale. Very important, a good water system. To improve water supply for the hospital, the rain harvest system has to be renewed. This is the John Museum building, housing of feminine nurses. Renovation is very needed. The ceiling is very bad and electricity is very old. Also the floor has to be repaired thoroughly. When Dr. Rob is heading for home, he knows that much has been accomplished, but he also is aware of the fact that your support for Nyakibale Hospital is still of vital importance.
Wafuka dola olinga paundi atanyikira takufuna guno mukwano gw'omungi gwennina